This workshop is our second scheduled workshop in the development of the FY 2019-20 budget session. And at this point in time, I'm going to turn it over to Brandy King, our finance director. I'll turn it over to the operations director.
Other duties as assigned, whatever. I hope that you will notice that some of this information, in order to make it more tolerable to sit through, is kind of relatable to you a little better. I do have all the details of each individual line items, and I'm happy to walk through them, but we're trying to go a little more 10,000 foot level here, so I wanted to preface that with this. So, first of all, when I started this presentation, I decided I would try to categorize what we do with the funds that we collect in the budget that we approve each year. So I broke it down, and these are my categories. They're not defined by anybody else, into required services, basic services, corrective services, and amenity services. And so they're just general terms, but I think they're pretty self-explanatory, and we're going to work on from there. And then let me know if you want details on any of them. Go to the next one. No, you went too far. That's all right. 3. There we go. So our required services are anything that there's a higher authority than us or a law that requires that we do them. So obviously we have to do them. Our basic services is going to be just your general government management functions. You're paying the invoices to the county, managing the county, that type of thing. So basically the basic services, in my opinion, is like the very least we can provide for our citizens. Our corrective services are going to be there. They enforce penalties. They ensure we have compliance with our rules and regulations. And then our amenity services are things that give our citizens pleasure and leisure, and they're for quality of life purposes.
The Sheriff's Department fall in there.
We're talking about the general fund right now, Commissioner Mayers.
That's a million.
He's in public safety. We're going to get to him.
You don't want to be there. That pot isn't very big.
All right, keep going. So our required services are going to be defined as the commissioners, as the governing body. You're here to adopt an annual budget. You adopt and vote on rules and regulations, approve recommendations by other various committees. So we're required to have you in order to levy taxes and those kind of things. And then our community development also, we're required to have that. So when you look at those required services, it costs about $850,000 a year to provide that, and we collect about $200,000 in revenue in the community development department. We use that revenue in community development, planning and zoning, and it goes.
The department's not a required service?
We're in the general fund.
Okay.
So we're talking about just the service departments underneath the Board of County Commissioners. And then any fees that we do collect, we put those right back into the planning department. That offsets the cost of operating, which mainly is going to be your personnel. All right. So there's some other obligations of the general fund, and these things, you're having a hard time with this.
I see what everybody gets all upset about.
Okay. So our guardian ad litem program, we're required to participate in that, and that just provides legal representation for children that are abused and neglected. So the way that works is we actually take money from the general fund and we transfer it into one of our other special revenue funds under the court funds, and that is based on our usage. So however many children actually use the program from our district, we get charged a portion of the program each year. Right now it's about $10,000. Then our general fund obligation, we also cover any forgiveness that we do for low-income citizens, such as our hardship exemptions for solid waste and fire, we're required to transfer that money to those funds to make them whole, as well as our building department. Anytime you do a fee waiver, such as with Hurricane Michael, when we waive some fees, we're required to make that transfer from the general fund. So those are things that we actually have to do. And then from time to time, we'll enter into an agreement, a grant match agreement, and it'll be a requirement that there's a portion that comes from the general fund. The best example that I have of that would be our mosquito control annual grant we have to transfer money from.
We also
Medicaid and our HICRA. So we do have a local contribution to our health department each year for their operations. Administration, which it covers David running the county, supporting other funds. Most of these basic service departments, they're really working on behalf of other departments or other funds. So administration touches every single other department fund, even your constitutional officers. Our collections department, any revenue that's collected there goes back to where it's actually coming from, such as EMS billing goes into the EMS department, wastewater billing goes back to the wastewater fund. Our facility and fleet management, we don't collect any revenue there. Our EMS revenue is about $1.2 million a year. And then our health and human services is going to cover your Medicaid, your HICRA, that local health department contribution, and other. Okay.
And I just wanted to comment, number one, if y'all got any questions, I think
Please
Randy's
stop.
Randy's already opened the floor for that. But please intercept. Now remember, last year was the first, we budgeted last year for the facility or for the fleet management to come over into the general fund and pull it out of road and sewer. So this is the first full year of capturing those costs as a standalone, and then they're spread out to each individual department, because what we found was it was all being paid for in the road fund, and we've got fire EMS is using it, the sewer, all this stuff. So that's the reason we broke it out. So this is the first full year of actually seeing what the true costs are for our fleet,
Good. That's the way it should
fleet
be. So
management system.
each department that uses it pays into it. So
That's
they have to
right.
budget
That's
X
right.
amount of money.
At the end of the year, it will net out to zero.
So you're not going to be drawing anything from the general fund to pay.
Well,
for
yeah,
fleet
because there are
maintenance.
some general fund costs that are in there. So the general fund will pay its share,
Right.
but the other funds will pay their share as well, which is a much larger share.
Similar to the gas. It'd be like the road department paying for all the gas and everybody using it.
Exactly, and that's what was going on. So that was a corrective measure that we made. Sorry.
Just for your information, our Medicaid cost share for 1920 is about $360,000. That's based on population / usage, and they calculate that at the state, and they basically send us a letter that says this is what you owe. It does run on the July to June state fiscal year, so we do have a little bit of surplus in that line because that unknown quarter at the end of our fiscal year, so it's got a little cushion in it.
And this year, we're going to the full amount, right? So for 5 years, they've been phasing it in.
Yes.
This year, we're going to get the full brunt of it.
And I can tell you that it's going to increase about an additional $30,000 possibly a year. See, I've got it out till 24, 25. Not quite that much. I got it coming in about $450,000 in 24, 25. I haven't seen any actual estimates from the state that went that far. So,
You projected all that the year 24, 25?
yes, sir.
Or you
Yeah.
did 2024 and 2025?
We
Yeah.
talked to several legislators last week at the conference and still trying to propose a cap that they'll cap us so we'll have budget certainty.
Killing me.
There you go.
Because right now, we're paying off of enrollment, not necessarily utilization. And last time we looked at the numbers, our utilization was low, but we're paying on the higher enrollment area. So some counties are winners and some counties are losers in that.
Yes, that's true. And so the cost for all these basic services roughly is $6.4 million.
That's also another benefit of commissioners going to the Florida Association of Counties annual conference.
We had a couple that are interested, whether or not something will come out about
Why
it.
do we
we'll
have to
see.
go? We got round, Brian Delevers, we can figure this out.
Go to the next slide.
Thank you, David. The yellow jacket.
this thing, that's gonna go through the wall then.
Not today,
I'm
okay?
gonna put it through the wall.
All right, so we're going to drill down a little bit on some of our basic services, and the largest thing that we have here is our EMS department. So right now, we're collecting about $1.2 million a year, and we have costs of about $2.2 million. We've kind of self-imposed a $1 million gap in that department. We're pretty much maxed out for what revenue that we can collect there. And then you have your insurance rates that impact that, your Medicare, Medicaid rates. They're only going to pay what they're going to pay. Doesn't matter what you bill them. So we've been very cautious about going over that $1.2 million mark because it's frankly not really reasonable. And so we just basically fill that gap in with general fund revenue, general administration revenue. But public safety, we all know it, it's the most expensive thing that we have in the county.
Well,
Most important, most expensive.
well, yeah, other than sheriff is it's expensive, but.
Yes.
But on the revenue, this revenue, as you know, is very hard to predict. We've seen a steady climb. We're doing everything we can between where is Louis and Marvin. Louis, Marvin, and Nanette, they work together and team up, and that we've done everything we can on our side. We feel like now. Marvin just instituted some new criteria for his guys on reporting that'll help the process and us get our money. But as you know, and we've also increased, the good thing is we've increased our calls, which is a good and bad thing. But the problem is predicting this revenue is tough because you don't ever know when it's going to be you could have a run, an entire month of nothing but Medicaid.
Let me ask a question about that.
And then all of a sudden that month, so you had a bunch of calls, but your revenue's low, and that makes it very hard to track. So we have to continually, what Marvin and especially Marvin and Nanette do, they make sure one is we're getting the money we're supposed to. Second, are we getting the information in correctly so that we're catching every little single thing.
That's what I was going to ask. When you bill Medicare, you bill them for the ride, and do you also bill them for other services that you do to the patient?
Marvin or Nanette?
Well, basically, the way it's done, it's...
Can you come up to the thing? I thought I saw Nanette.
You did.
She
Oh.
waited for somebody else to talk, so she didn't have to.
Yes, he has more experience.
It's very gracious of you to say that.
My name's Marv Walters. I'm the EMS chief, Wakulla County Fire Rescue. The way it's billed is we charge, there's rates for, they have, Medicare has EMS 1, ALS 1, ALS 2, BLS 1, BLS 2. And what this does is separates like your ALS. If you do a certain number of procedures, then it goes to ALS 2, which is a higher rate.
And that stands for Advanced Life Support, is that what that stands for?
Yes, sir.
And BLS is Basic Life Support, I
Yes.
guess. So there is a scale.
There's a scale.
You bill them for whatever medications you give them.
Yes, and and they don't, it's not like you say, it's not charged per item. It's charged if you give so much medication, then it goes to another rate for Medicare.
Gotcha.
But their rates are the lowest of anybody that we get reimbursed from.
Yes.
They're what?
They pay about a third of what what we
costs are.
charge, what our costs are.
What percentage of our calls fall in that category?
Medicare, we're averaging around 28%. Medicaid, we average around 6 to 8% a month.
And that's
Those
the
are costs.
same deal with Medicaid, right?
Yeah, Medicaid is like 6 to 8% a month.
But
Is
they have the
Medicaid.
same pay rate,
Same, yeah, similar, very similar.
35%, 35% are the calls that we lose money on every time.
But
Yeah.
what we wanted to make sure of is we can't control what Medicaid
No.
and Medicare give us, but what we
Right.
can control is making sure that we get all the information correctly from the
Right,
patient.
because if you don't get the information correctly, then it could get charged at the ALS 1 or BLS 2, it makes a difference on how you put the information into the report.
That's right. So he's really, Marvin and crew has done a really good job of doing that, as well as Nanette following up with our EMS and MC
Right.
folks, and making sure that everybody's communicating, and we're checking all the boxes now when we didn't in the past.
Right.
So
Basically coding, sounds like coding in a medical
it's
office.
yeah, it's a lot of coding. In
Lot of
fact, I think
coding.
you have a degree in coding. Am I right?
As a matter of fact, I do, yes.
Yes, she does. So from EMC.
So are the majority of our calls private payer insurance or no insurance or?
Well, what it averages out is about, I think it's averaging now between 26 to 29% or private insurance, and then it's about that for private pay.
Okay.
It averages about the same for the private pay.
And those are billed the same rate, right?
Yes. Everything's billed at the same rate. It's just Medicare, Medicaid pay less.
And the price of drugs has not went down lately.
No, the price of drugs has actually increased. I don't even know the exact number now, but it's probably 30% more than it was last year. And we were dealing with a lot of shortages and stuff with medications. So we're doing a lot of substitution, like narcotics. We carry 3 different kinds of narcotics now, just for the simple fact of shortages. Stuff as simple as IV fluids. We run out of IV fluids, so you have to stock way ahead and stuff, and that, the prices go up because they have a shortage, so the prices go up. Supply and demand.
So why is you saying, as I understand this, it's going to vary depending on how the service and the insurance. Why do you call the 1.2 million as being maxed out?
Well, I wouldn't say it's not necessarily maxed out. $1.2 million is probably about as good as we're going to get based on the runs. Now, as the runs in the future
Go up.
this revenue will and the deal we had made with them was the idea is to have to fix EMS and to incentivize Marvin and Louie and the guys moving forward to get all this information together and do it. We said we're going to hold the contribution of the general fund at $1 million, and the rest of it has to be made up in fees to get it done. Because what we said we would do is, as those fees increased, that would allow us to do further improvements in salary, further improvements, etc. And that's the reason we set this $1 million goal. But it's worked out exactly right. We've held to it. We've actually bumped into the $1 million one time, but we stayed under that. But we've steadily our revenues have steadily increased, and we've held that down. The problem is now is probably that 1 million. Our projections look, even if we keep increasing with the increased rate of our revenues, that $1 million is going to become. But we're going to keep some sort of ratio there. Our costs are creeping up on that, but we've done a very good job of holding that line. Also, as a part of this, and now that we have our firefighter paramedics dual trained folks, is we're splitting correctly, splitting some of this with the fire MSV. So a person, firefighter paramedic, part of his salary or his or her salary is paid for out of the MSVU, and part of it's paid out of EMS.
It's a very conservative percentage too, right?
Yes.
Just to be sure we don't get
Just
sued.
to be fair, and then we've made sure we run that, and she runs that on a regular basis to make sure. So that was the mechanism that we went forward with. We had to put something in that gave some incentive other than keeping your job to do this, and it's worked out right. It's worked out really good, and everybody's bought into it. So moving forward, though, as these costs continue to go up, the cost of meds and all that stuff is going up higher than what insurance companies and Medicaid, Medicare are wanting to pay.
How much revenue were we collecting when Nanette started over there?
Nanette, about
800,000.
800.
Up a pretty good bit.
So it's went up at least.
well, that
500,000.
was when I first came here. It was about 450, something like that, and we've increased it now.
A lot of that was write-offs, just right.
A lot of that was just not billing and you know, a lot of different things, a lot of different things.
I know, but a lot of, I know what it was.
Yeah.
Are we still outsourcing the collections, and how is that?
Miss Nanette, thank you, Marvin. You may want to just hang around right there.
I can probably still answer it as well as I can. Yes, we're still outsourcing that with EMS MC out of North Carolina.
And we're seeing good recovery from them?
The collection ends of
We're
it,
at 40% of what we're billing.
Just wondering how that compares to when, I know you've got a lot of hats that you wear, but when you were doing that yourself, are they doing better, worse?
I think they're doing better at the collections, and that is one of the few areas that we've seen that we've instituted now that we're starting to help them a little bit, that before they send their accounts to collections, that we're reviewing them. And this is the first month that we've started doing that, and Brittany, who's doing that for me, has picked up on several accounts, gotten the information, gotten the insurance that we'll turn around and able to bill for them. Because you figure you do 3 to 5 of those just in a month, which is easy, you know, that's an extra up to $5,000.
So you said you're at 40% collection rate on private payer?
Total.
What do you mean? So if we bill
Of all the
$1,000, we're only collecting
gross,
$400?
the gross that we send out right now for the year so far, the budget year, the gross that we've done, the net that we have right now is 40%. Because I just ran.
Counting Medicare, Medicaid,
So if we got
everything.
100%, we'd be over that 2.2 million.
Yeah, for the most part, what the overall, anywhere that does billing, EMS billing in the EMS world, about 45% is about
Average.
Now, that's across the board? I mean, what percentage of the bills that you sent to private payers get paid?
I don't know on the private pays.
Private pay is not good. Our best insurance, our best thing that we get paid for is commercial insurance.
Yeah.
CHP is your best friend.
Yeah.
I mean, we do really, really well. They have commented, the billing company's commented several times that nobody else does as well as our county does with that, and it's because of CHP. We've never entered into a contract with CHP, which would reduce our recovery. So it's really fantastic.
You say it's 50% maybe that we recover from private payer or less?
I don't know without running the numbers.
Yeah.
I'd have to run it.
No, you don't think so?
I don't think.
I don't think so,
doubt it.
no.
Those others were 25, 23%. I would guess they'd probably be about the same.
Yeah, and understand too that with Medicaid, to see that whole picture there, that if an average run is $900 to $1,000, that Medicaid will pay $133, and they're by far our worst payer. To get them to pay, I don't even know that it's worth the effort, the time and effort that you put into it. I mean, I've seen them pay as little as $93 on a run. It's absolutely ridiculous.
When they'll just all of a sudden stop paying it as well. And Lynette and Marvin have to jump through a bunch of hoops to get it cranked back up again.
Wow.
And so the federal government's the worst there is to work with.
For sure.
So we're going to have to just bite the bullet and augment this for the rest of the...
Well, I think we got a good program moving forward, and we got a good plan, but there's going to have to be some augmenting of this in the future, yeah, as we continue to grow. This is going to be one of our growing pains, and we're going to have to really watch this. And you know, we put this in the same category with as we do with the sheriff's department and the cost of running our jail for our local inmates. That's something that in the future, as this continues to climb, is going to be like that we don't recover all of the costs for our jail, for our locals and our jail inmate, and that's that nut that we always are trying to chase. This is the same thing. That where do we chase that and how do we get there?
What I would like to see us do is address the legislature the next time they're here and talk, and maybe they can look at some funding mechanism that they could create in the legislature to help small counties. If I'm not sure that they know how much of this we bear. I mean, that's a lot of money for a small county to have to augment year in and year out. When the system is just like it is what it is, I mean, we know we're not going to get any better than that with Medicare or Medicaid. So why don't we, I mean, let's talk to them and see if they can legislate something that...
Well, and that's a possibility. Ralph can probably speak more about that.
I talked to Representative McCain in last week, and he was very receptive to the utilization part. So right now, we're paying based on enrollment. We could have a lot of people enrolled, we could have no one using it, or very few using it, and we're paying a larger share. And, you know, I said, look, even if you can't give us the caps, make us pay on what we're actually utilizing, what our citizens are utilizing. If we're paying more, we pay more. If we're not, then we shouldn't have to be paying more. And he liked that idea. And so we're going to keep trying to build on that. It's either a cap system or get back to a utilization. I don't know. It's a big dollar amount. You know, it's big for us. Imagine the whole 20 million people.
Yeah, everybody, and the county managers meeting, every county, no matter whether it was Miami-Dade or Liberty County that was represented there, all have the same issue. Some counties privatize their EMS, but that's because they have hospitals in there, but then they're not happy with that. Most of them are not happy with that. So, you know, we have a unique situation here, but we feel like we're providing a great service. I know we are for the dollars that we do invest in it, and this is the reason that we're continuing to hammer, and we've dedicated people to it, and these two have dedicated a lot of their days and their staff go towards collecting that $1.2 million.
Is MSTU still an option to fund ambulance?
That is a possible option that we'll be bringing to y'all into the future, but that is a possible way to make up that difference here, and also the jail.
Taxes.
Also the jail.
$10.
Also the jail thing, but that's another conversation for another day.
You can do that MSTU.
MST is ad valorem, it's just separate ad valorem.
Yeah.
It's just a separate pot.
Yeah. But that's another subject for another day.
I'd still like to see us do lien assessments for non-payers, just like we do code enforcement and lack of payment on
I
property
think you
taxes.
do that, right?
Yeah.
You want to talk about some pushback?
Well, I mean,
Elderly person's house because they don't pay their average bill.
I understand that, but everybody else is picking up the tab for people that's not paying. And so I think that there's a lot more people that would be for the idea than against it. There'll be some tough conversations.
All right. Thank you guys, ladies, guy and lady.
The other unknown that we have in our EMS department is any accounts receivable write up or write down at the year end, and it's unpredictable. I'm getting the stink eye from Greg, but it is something that does affect this department, and so we need to be conscious that it can, look, I'm looking at 16-17, and it was basically a deduction in the fund on the revenue side of $290,000. And then in 17-18, it was a increase in the department of $47,000. So it's a maneuver that has to be done each year to reconcile. So it has to do with accounts that have not been collected yet, but are due to the county. So that impact there, we just have to be conscious of it.
So how old are
The 1 year for the write-off.
That's kind of what's happened at the Regional Planning Council. If they get too far off, on their asset side, they were counting accounts receivable that was 10 years old. They knew they were never going to collect.
We don't do stuff like that.
Well, when I first came on board, and that was one of the problems that we had. We had a 10-year write-off, and we had to get rid of that. So now we're down to every year we're either writing up or writing down.
All right. Any other questions about EMS? You missed a slide.
Make it full screen, Patty.
All right, our corrective services, these are going to be our animal services department, our probation department. We collect about $86,000 between those two, and it costs about $470,000 a year to provide those services. So they're your enforcement, your biggest expense in both of those departments is going to be your personnel. It's your biggest asset and your biggest expense. Now for the fun stuff. So our amenity or our pleasure, leisure, quality of life services are going to be our library, our extension department, our parks and recreation, and these are just our general fund parks and recreation. Recreation has its own specialized user fee fund as well. So if you sign your son up for soccer,
Daughter.
it goes, or daughter, it goes into that user fee fund, and that's a standalone fund that has to live within what they collect. Parks Department as well, there's the boating fund, so they have a couple other little specialized funds as well. But this is just our general fund service departments, and then our veteran services. So the cost of these amenity services is about $1.3 million a year, and in the general fund side, it collects about $100,000. And these are the things we provide for our citizens for their pleasure and enjoyment and quality of life.
How do we get better there? Is there, or is it- we're just gonna have to always,
Well, I was actually asked by one of you how we get more money for parks and recreation, and I have some simple options for you. The way you do it is you divert resources from one of your other service departments. So you shift some funding and you would maybe reduce something, eliminate some other service that we provide. You would increase fees to use these functions, or you would increase revenue in some form. And it really, I don't want to sound flippant, but it really is that simple of how we do it. It's simple to say, but when you're talking about, okay, we're increasing a millage rate, or now it's, if you want to get a park pass, it's $60 a year instead of 40, that's when it becomes more of an issue. Did you have something to say? Looked
that's
like you were
$1.2
thinking.
million.
Well, yeah, but that's
That's what we're here for.
that's what we're here for, and that you'll never recuperate all of that. And the good side is on the park side within the boats, and the boating fund is paying for itself. And also on the user fee for the recreation, though that's paying for itself. What we're paying for is maintaining the fields, and all these other
Library.
things are just their library extension. Those are things you have to have. Veterans, parks, that's just an amenity for what we do. So I get
Pay
you.
taxes.
That's right.
And if you don't have these amenities, this is vital for our economy.
And I will tell you that all of these departments listed up here, they function lean. That the amount of activities and things that they are able to accomplish with the amount of staff that they have is pretty remarkable, and the different library programs, and then last we've got our gardening programs and 4-H, and so what we get out of this $1.3 million is a lot. And so the only way to increase these services is to add personnel and to add staff to them. Because if you don't have that staff person there to manage that program or get the word out about that program, it doesn't do you any good to have that program and offer it if you can't operate it.
We've got, if you didn't get the calls over the weekend, our boat landings. I did. And it's basically, our boat landings our ramps are packed. And we're going to have to do something to start solving this problem. And
And the majority of it's not local county people, it's outsiders coming in here.
they might be outsiders, but they're spending money in our county.
Oh, I know.
Okay, so that's
But
not a... it's
We're
not a
paying for the
downside.
boat ramp.
Well, we need to make sure we put ramp fees on this.
I agree.
We got ramp fees.
We just got to make sure people are paying them. But like I say, that is something that we're looking at doing as well. Is we're bringing something back to you guys in the fall that will address that. Okay.
And just for a reference point, anytime we add one of a frontline employee, their wages and benefit package for just one employee, depending on what health care level coverage they have, can be anywhere from $40,000 to $60,000 when you include FRS and the FICA and all that stuff. And so that's what you're looking at if you want to add more staff, is anywhere between $40,000 and $60,000 for these departments.
You're talking about not including their salary, just for the benefits?
No, that would be their salary and
Okay.
benefit. And the big fluctuation is just because the board's commitment on an employee-only CHP is $8,800 a year. You have family coverage, and that jumps to almost $23,000 a year, that cost. So it's a vast swing just depending on what they choose and what type of coverage that they need.
Do we have, just speaking of that, do we have any incentive? Let's say someone's married and they could get on their husband or wife's state plan. Do we have any incentive to say if you switch to a single, or if you choose not to have insurance, we'll give you some of that $23,000 back that we don't have to pay?
We do have the flex plan available. If you don't have CHP, you're eligible, and that reimburses medical expenses to $2,500 a year.
That's not what I'm saying. I'm saying if that person is on their spouse's insurance, instead of us spending $23,000 for capital health for them, we're paying nothing. Are we giving any of that money back to the person, or is it simply considered a benefit if you use it or you don't use it?
We're giving that benefit, we're giving them that as a benefit is this program that she's talking about.
I use it, and
Yeah.
it's because I don't need the insurance. I have insurance because I'm retired military, so I use the flex plan, and then it's a benefit for me because I can still submit my claims that are over and above my insurance, and they pay it.
Right.
So, and there's a lot of our employees take advantage of
They
that.
pay it?
No, they pay us.
So do you put your money into this
No,
flex plan?
no.
Okay, I got you now, okay. I thought you was talking like a medical
No,
savings account or something
A
like that.
health services account,
No.
savings account.
All right, so those are the things that we already provide, so what else can we do? So the two things that are kind of rearing their heads right now is economic development and risk management. So these would be two service departments. They wouldn't really impact your citizens' lives on a day-to-day. They're not going to see anything out and about, but there is the potential for a delayed impact if we can avoid a lawsuit or something along those lines, or if we start to grow in the right way. So there's potential long-term impact to your citizens, but it's not anything that they're going to see a benefit from immediately, like if they go to the library or go to Azalea Park and walk the trail.
on the economic development, on each one of these things we're looking at, the economic development, that more than likely will be a consultant service that we'll be looking at from a standpoint, just primarily due to there's other funding that'll be coming in, or promised funding from the EDC as well as
NG Wade.
NG Wade and Son, NG Wade. So therefore, it would be, and that's a 3-year commitment from those folks. So this would be a consultant that we would end up hiring. And after that point in time, it would either say, okay, it worked or it didn't work. And if it does work, then we'll look at that point in time. Do we continue that, or do we drop it, or do we bring it in-house, or what do we do? The risk management, that position is a position that is every year we continue to have. Seems like we're having a hurricane about every year, and between our insurance, between managing damage from insurance as well as FEMA, we don't have the staff currently to be able to do those things and do them well. I believe we're leaving money on the table, and that's one of the things, as well as another that this position would do. Another thing that I'm concerned with is now that we have pulled in public works, we're even more. We have more risk from a standpoint of we have more people out on the road, in harm's way. I'm concerned we've got our safety committee, we've got things moving along, but are we as safe as we can be, and are we doing the things that we need to do? And no one person is really focused on that. So between and also within our buildings, and we don't have that risk management. That's just two of the positions that we're looking at.
But the risk management is not something you could sub out either?
It's possible. It's possible we could sub some of that out, but the problem is especially with when you get into the insurance and the FEMA and all that stuff, those are things that we've got to look at, but that's a possibility.
I just have a vision of a county OSHA type employee going around.
I don't want that. I'm not a fan of that either, but we got to take a look at it, and that's the reason we've got these here. Don't know. Those are just things to where we're economic development, we have an opportunity there, and then risk management, that's one of those things that's
I mean,
it's not sexy at all, but it's one of them things that we gotta start looking at.
even moderately sized companies have a safety officer. I mean, we
Right.
have one at PSG.
Right.
With
And that's what this-
full-time position, but,
That's right, and that's what this would be, is something like a safety officer, but also the FEMA and insurance after a hurricane, and this, as we're finding out, the insurance companies are doing something, FEMA's wanting to do this, and it's all, am I right, Debbie and Annette? It is all over the board, so it's not getting, and FEMA is not getting any easier.
that's another federal government agency, isn't it? Okay,
Yes.
just checking.
And it is not getting any easier, so, all right.
So both economic development and our risk management, they're not a required services. So for me, I would categorize them as another basic service that we provide. Again, it's not pretty. It's nothing that's going to impact your citizens. They're going to see a immediate result. Probably won't even know that you're doing it, but it's just something that we've been discussing. And as you know, the commitment from the chamber for the funding, partial funding. So
Is this going to be in the upcoming budget, David? These two things?
We will probably have, I know we'll have the economic development, and we're debating right now the risk management.
You couldn't just get other duties person over there to do it?
who's pointing at?
Or
I'm not sure. The thing about the economic development, though, is it gives us the control a little bit so we grow responsibly, and it takes our environment in mind. We have that control, and we can consider the uniqueness of our county when we go out and we kind of recruit what we want, and so it just puts a little of the power in our hands, and we make stuff happen to us. We don't let stuff happen to
I
us.
think I've expressed my opinion on this several times. I'm pretty skeptical about it, but if it can return it, did you ever talk to Beth?
I haven't reached out. I've got other things I hadn't focused on, other than I've got a couple names. Heather's given me some folks as well, so, but the time's coming.
Like I said, I don't want to spend money just for the sake of saying we're spending money on it.
Right.
I understand, and neither do I.
Yeah, we got to make sure we'll have a program before we take off, I can guarantee you that.
Wait a minute, what are you saying, Randy?
We had that economic development workshop, remember, and the people stood up here and said, you got to have this person or you're not going to,
And they're gonna give us money.
Yeah.
and, but just to pay somebody $50,000 a year just to say we have an economic development person, I don't.
We need to see your return on
If
investment.
they show that they bring in 100 jobs a year, but pay a certain amount of money after, try it for 3 years, fine if it pays for itself, but not just to say you have one.
Yeah, we need to have deliverables on that one.
Yes, metrics.
Most definitely.
You went past that's okay. So, and on the risk management side, we know we're never going to mitigate every risk, and we're never going to be able to have no exposure anywhere, but it's just a way to help minimize and prevent any loss to the county from those risks if we can get out in front of them.
Management mistakes, y'all don't make mistakes, do you?
Everybody makes mistakes from time to time.
Yep, we do have our share of them.
Not at the sheriff's department.
Oh, wow. So, the theme here, poor Jared, is just being very intelligent in how we grow. The things that we do provide our citizens, that we know we have to, the things we want to provide our citizens, and the things that would be nice to provide and nice to have working in the background that they didn't see. As we grow, and we are, just managing that balance of what do we have to have, what do we need, what do we want. And so that's why we look at these things and we talk about them and try to plan for them as best we can. It's nice when you have a commitment of funding but yeah, there needs to be some, on both of those, there needs to be some kind of milestones, deliverables, and different things. So
The community center is also an amenity, right? Is that,
yes, it's under the recreation blanket.
It nets out.
it does net out, okay.
It does. We have the contract with Rivertown Community Church.
They pay good.
Yes, they do pay very well, and it's the cleaning and operating and utilities expenses are not tremendous over there.
Thank you, Mike Stewart.
That's a really good partnership.
Thank you, Mike Stewart.
So on a non-hurricane year, how much involvement do we have with FEMA?
Well, the problem is right now, we're dealing with storms all the way back to Irma and Hermine. So
So you have enough work for somebody to be working on this?
Don't,
FEMA connection?
don't forget about the audits we get by FEMA too for the
well,
fund map.
yeah, and you'd be surprised, yes.
Flood insurance.
Could we right now have somebody doing FEMA work? I guarantee we could have somebody doing FEMA work probably 3/4 of their day. That's how much stuff there is out there that has, I mean, realize at one point we were working storms all the way back to 2006, am I right, Nanette? I believe it was 06. We were working storms, and they'll bring them up. It's just,
Which one?
it's never ending, never ending.
I used to do that, right?
And I wouldn't bring it up
Got
other
Nanette
than it's
started.
just- it's gotten, and the
I'm writing
problem
W.
is the more they've improved, they've said they've improved the program, the worse it's got. And it's like, good, and that's even proven by, I was at the county manager's thing. That was everybody on the coast, the same thing. It was like, good gosh, y'all quit improving. Stop.
What year did I leave, Nanette? 2006, wasn't it? You go.
And
Been done
actually,
before then.
on that note, when we submitted for Irma assistance, we actually got a bill from FEMA for about $15,000 from, I believe it was Dennis, from when they did their audit, that we had to turn around and cut a check back to them for a storm from
Lucky it
2012.
was that small.
Amen.
We got a brief from NACO last week, and one of the things that they're working on is to try to get a bill passed in D.C. to limit the clawback to 3 years. That if they don't get it back in 3 years, we keep it. It's over. It's done.
That's huge, because just like what she was saying, that was a clawback.
Yeah.
And if we've got staff here that's working on a current storm, they get all that out, next thing you know, once that reimbursement gets in there, it's like they come back and say, okay, we got to try to find that money somewhere, and then we have to, problem is we have to send them stuff over and over and over and over, and it's in a different format, and you're right, that callback, if we could get that done, that's huge.
Yeah, these are the things that we need to get to Congressman Dunn and our senators and see if we can get that thing
Well, and
passed.
right now, all the folks that was there, it was Monroe County, they're 2 years after Irma, and they haven't been reimbursed,
Yeah.
those counties. So, yeah, there's a couple counties that's got some serious money laying out there, waiting for reimbursement. Serious money.
Enough about FEMA. All right, go to the next one. So we're just gonna, he just can't wait to talk about the sheriff,
Buy a
can
new one of them things. Put that in the budget.
I keep asking Jessica, but she won't do it. She tells me it's fine.
All right, so we're just going to go through this really quickly. This is our revenue stabilization fund. We set this up so we could minimize any impact of a sudden or unexpected revenue loss and supplement other departments and funds that we were concerned about. I'm looking at probably $500,000 at the end of this fiscal year in there. The additional interest that we're earning because the clerk's done such a good job at hitting those interest pools is going into this fund. In 16-17, the MSBU fund, before we started correcting, we actually borrowed money from this fund. So in 1920 and 2021, we're scheduled to repay it back, that $129,000 from the MSBU fund, now that we're seeing that correction and improvement there.
Didn't charge ourselves interest, right?
We did not charge ourselves interest, no.
Thought about it.
All right, now you can go to the sheriff's fund.
All right.
So our working budget right now is scheduled to increase the transfer from the general fund to the sheriff's fund by about $457,000 over the current year. We're still on that same plan of holding that jail bed revenue to the $1.8 million, even though we anticipate we're going to collect $3 million. We feel pretty confident that the fund balance portion of the problem is righting itself, but we are still using cash on recurring costs each year in this fund. And so, for example, even if we were to take that $500,000 in our revenue stabilization fund and prop it over to the sheriff, it would only fill that hole for 1 year, and we would have no money in our revenue stabilization fund.
That 470 recurring, they're asking for, or they're asking, I don't know if they're asking for a budget increase of 457. So is now the recurring gap going to be 900,000?
That is the transfer from the general fund. Hold on, I've got the sheriff's budget right here. So let me take out. So their current year budget, without any cash forward for equipment or anything, is about $11.7 million. The request for 1920 is 12.1. And in order to get there, without using more cash from their fund, we have to increase the general fund transfer there. And that's the hole we keep talking about. So we've fixed one part of the problem, not the other. This
The
goes
hole's getting
back
bigger.
to our MSTU discussion and the fact that we'll be bringing forward a master public safety plan, because EMS, fire, and sheriff, they all go together, and we should be able to establish a mechanism to augment them collectively, possibly.
I remember the sheriff's department definitely didn't want an MSTU because basically the millage rate would be, for the county, would be like 1, right? And the millage rate for public safety would be 7.5.
Jared, you want to speak about your budget and what you turned in, you or Jan? I know Jan was wanting to talk.
Well, the difference is if we go with the floor retirement, it's going to go up $62,873. Workers' comp goes up $37,000, and health insurance we estimated $181,000. So that's $281,000. And if you decide to give the 2% raise, that's $140,000. So that's where that money comes from. That's
Yeah, so there's no additional officers or any...
we're not asking for anything now.
That
That's
last
just,
year, right? We got
that's right.
3 additional officers last year.
we got 5 additional officers,
5.
and we appreciate that. We needed it, but this year is all just dead costs.
And your inmate medical too, what did your inmate medical go?
Yeah, that's going up
30?
to $29,925.
Yeah, and so a lot of the things that he just mentioned, the FRS is mandated, they have a contract for inmate medical, they just can't get around them. The COLA is optional, of course, but, the FRS, the health insurance, is a benefit we provide.
Are you guys estimating that the roll-up rate will cover most of this stuff? If we keep millage rate the same.
I try not to go to the roll up.
No, you know what I mean.
Yeah.
Whatever revenue 8 mills generates today, if we keep it at 8 mills, will it cover these?
It will
costs?
chew into it, yes, most definitely. We can fix it.
Because these are the things, things cost more every year.
And just so you know, that's actually what my working budget document is based on right now.
Our working, that's right, and we were going to get into that, but our work document does envision, just like we promised you guys last year, we're going to have to hold to the 8 to continue to fund the sheriff's department and this not get any deeper.
And every other department.
And every other department is going to have to hold at this point in time at 8 mills. Yes.
Yeah, I mean, that's just
The only other way to
facts.
cover these costs is for you to fire people, basically.
That's right.
Okay.
I mean, we've got to, this is dead costs, that costs every year, so it's going to go up every year. So if we go below 8, then we're going more in the hole.
And y'all doing great on the jail bed revenue, by the way, so that we think they're going to hit
We met
fund balance?
We met the 1.8 last month, so we got
Everything from here
4
on out.
months left of this year and this year I think this month we're looking at close to 300,000. So
They'll hit fund balance this year, you think?
Yes.
Yeah.
Then after,
Then we keep turning around and we keep spending it, and right now we're spending cash for them on equipment and vehicles as well to let the
Just what we
1 cent
talked
sales
about.
tax
Yep.
have a rest,
Yep.
yes. Doing
and you
just
talked
what we
about
said
you
we were gonna do.
utilizing it for your employees
yeah.
at some point, too.
Well, and we're doing what we said we were going to do is there's jail repairs that need to be happening. We're improving our facilities as well as purchasing vehicles with some of that excess money. But we're also building their fund balance to where it will be at par where it needs to be.
Well, once they're at fund balance, of course, everything else is fat. So we're talking about building this maintenance facility
Now,
and
you consider that you're burning another 470
Yeah.
of it each year, so you're putting it in and then you're taking it right back out.
Well, and, we've discussed this 100 times, that if we knew what the jail bed revenue was going to be, that's a sustainable model. But if we don't, that's where the problem comes in.
Well, and we're still subsidizing the local operations with that jail bed revenue about $400,000 a year.
And that's a lot better than it was.
Better than it was.
And
We've isolated how much local cost versus ICE, and we've been doing that for the last 3 years, and at least we know where we're going now.
we could make some hard choices and come up with 400,000
Yeah,
through the county
from
government.
where we were, you guys have really helped us, and we've all worked together to fix a big problem. I mean,
It was close to $1 million, wasn't it?
Yeah,
one time,
it
the whole-
was a couple million.
Well, I'll always say this every time I get up here, we can't be in the ice business forever. Right now, it's good. We'll continue to be good, hopefully, for the next few years. But it's a burden on me as the sheriff and sheriff's office. So we need to get this money while we can, because it's not going to be forever. But
And you could decide you don't want to do this anymore.
yep.
And then we as a county would have to come up with $470,000 worth of cuts,
That's correct.
and then we'd be back to normal, which I think we can do that. That's not, we got to come up with $2 million worth of cuts, or we could raise to 8.2 mils, and that would cover it, or whatever.
It would wipe out the whole ice, and then 400 and something thousand.
All right. Any
Thank
other
you.
questions for Jared? Or, excuse me, Sheriff Miller?
What about Jan? She gonna say anything?
She gave this to me.
Okay.
Jan. Okay, as we were talking about the public safety master plan, we're currently working on that. We're pulling together all the information, the background information at this point in time. The idea envisions that we will move or create substations in a couple of locations in the county that will combine the sheriff's department, fire rescue in those facilities. And one of those being that we're looking at, just to let you know, is up in the northeast part of the county, up around the Opportunity Park area. That end of the county, I think, from talking to the sheriff, they're by the time they get a call and they get out there, that is one of the, other than Smith Creek, that's one of their longest and response times, as well as fire rescue. And also, we don't have a fire rescue component up there to where the majority of those folks can recognize the benefits of being near a VFD or being near a fire station. So that's what we're looking at is, and also a possibility of a substation like that in the Panacea Medart area, to where we're taking the sheriff's department and our fire rescue and putting them together so that the sheriff, they can instead of people going in that area that go back and forth to the sheriff's office to go home, they can just go there. Is the idea is where that way it's kind of like a neighborhood policing, etc. And as our county grows, we're going to need this more and more.
I think increased law enforcement in Panacea would be a great idea.
And that's right. And so we've got a couple of strategic areas we're working on right now. We're running we're getting information on running where we go to calls, where are those calls at, what type of calls are they, so that when we present this to you, we have some background information that says here's why we suggest it be here. Because one of the things that'll be controversial is like in one of the things we're looking at is in St. Mark's. We're looking at moving by getting our own because we're having some issues with the St. Mark's defunct VFD at this point in time in the city of St. Mark's with the fire station there, but also for it to benefit, for our fire service rating to benefit a larger area that are not getting any benefit now in the southeastern part of the county. We need to move that up just past 98. We need to create a station up there that it can serve more people, and we've got
Catch a lot of
people. And what we've got now is Louis has been working on that. Is we have a plan from a fire standpoint that'll pretty much catch just about everybody, and it'll be within 5 miles, the majority of the county. But it's going to mean moving away from St. Mark's. It's going to mean moving away from Shell Point. Shell Point, we're looking at our land trade, moving up and building a facility up
Out
off
of
of
the V
98.
zone, by the way.
And moving out of a V zone. And in Panacea, it's a possibility that we would get rid of one, either Obey or Panacea, and create one larger one there. That has its own set of problems. But we're looking at, those are the things that we'll look at. But when we present this to you, we're going to present it from here's where we are today, here's our problem areas, here's our plan for the future, and then from a capital standpoint, here's how we can pay for it. Realize this is a 20-year plan. Here's how we can pay for it. And then from an operational standpoint, we're going to project out our housing, what we think it'll be in the future, and our population, and then see how that works out and say, here's the holes, and here's some ways to fund that. Just so that we've got it, so that moving forward, the first thing we need to do is purchase the land. If we agree with the study, purchase the land for the substations. And if we don't do anything else in the next 10 years, let's get that done. Then it's strategically purchased, and then we can worry about the rest of the stuff.
And I think that is a good point, that getting these emergency response buildings out of harm's way during a hurricane, because if they are under 8 feet of water down in Shell Point, can't respond to anything.
Yeah, and as we know, these structures, we're going to need to, as we, obviously we're getting more and more hurricanes, more storms, we're going to need to have some hardened structures so that we can have a response team stationed in a hardened shelter station that'll have the sheriff, fire rescue, that'll be on that side of the county, and one here and maybe one in the Sop-Choppy area or something like that, to where we've got, or around the population centers, to where we can have a quicker response versus having to come out of Crawfordville to do everything.
Now, we have the existing Medart fire station. Could that simply be modified to do what you're talking about doing?
If we're fortunate enough to get the funding from Triumph Gulf Coast to build the library and create a shelter at the library, the plans is to take the existing library and convert it into Medart. Because the problem is the Medart facility, we don't have a lot of land, and the buildings there are about done. And so that would need to be completely dosed. So instead of doing that, is to convert the Medart, then that becomes a substation as well.
Grocery store one time.
What used to be, so that allows us to utilize the facility that haven't purchased.
And you still need a place in Sop-Choppy, or that's close?
No, Sop-Choppy would remain a VFD. Okay. And so would Smith Creek. We don't need a substation in Smith Creek. We've also got to look, one of the things we have to look is our northwestern part, not northwestern, but northern part of the county is, right now we have we have a VFD, Crawfordville VFD, and our main station, and then we have Riversing. Riversing is there it has a fire truck there, that's it. But our population center is north, so one of the things we're looking at is up off of Bloxham Cutoff is an area up there. We can put a station up somewhere around the Douglas Field area, kind of towards Lonnie Raker Road, and that covers the rest of the county out to Wakulla Springs. And also we're looking at traffic accidents, and that's a big focus up there for those. So it would work to have a substation up there and get rid of the VFD here in Crawford, move that VFD up there. So those are things we're looking at.
The county has some property on North 61, specifically for a volunteer fire department place.
Right. Well, we're going to look at that, but the problem is the way this model works. We're saying get the maximum, then it's like boink. Okay. That's where it's got to be. Yep. Okay.
The other thing that I wanted to put out about a master plan is when we do these and we plan out, we are more likely to possibly have some grant funding opportunities or legislative funding or something like that if we have something organized and prepared.
In a plan.
All right, we got to rock along now. All right. Road department. So we have our third road maintenance crew now in place. We have the actual data for the current year through April 30th, which I actually just received May's as well. I'm projecting that we're going to collect about $450,000 more than we're going to spend, and that we're going to be really close to fund balance at the end of the year in the operating fund.
Was that helped by what you did with the
It's-
maintenance department?
Yes, and it is very rewarding to see that we put that effort in and we made that decision, and it's actually, being successful. So that was a very good move we made on the part of insourcing instead of outsourcing. So now that we have the costs down where we can manage them, we actually could potentially add more staff to provide more and better service. So we have some wiggle room in here to continue to make adjustments and have this road department functioning awesome.
Well, and our maintenance crew is, which they were doing exactly what we needed, is our ditching crew. They started in St. Mark's, worked their way to some critical areas in Shell Point. Now they were over in Panacea. I'm not sure where they are now. They're
That
still
Alvin?
in Panacea. Alvin and his crew, and we've got a lot of feedback, believe it or not, from our citizens that really appreciate St. Mark's, really appreciates it, and you're seeing a lot of effect. One of the things we're looking at is we don't have enough mowers, mowing crews out. And there's two things we're going to look at. One is Mike's looking into getting a smaller tractor with like a 8 to 9 foot cutter on the back of it to do some of the smaller roads that we have to where only require one pass. And right now we're using a gang mower, and the other side of the gang is hanging out, so it doesn't make sense. And we don't have enough tractors per mile of road. So, and that's where we've gotten smarter. So we're gonna look about buying a tractor for that and a person so that we can cut that, because right now our cutting cycles are too far apart. We got to cut faster.
They make one, David, with a mowing deck. It slides out. It's not an arm mower,
Yeah.
but you can drive and it'll mow off.
Yep.
You know what I mean?
And we've got we've done a really good job with that. One of the things we're looking at as well is we're going to have a more of a maintenance crew that'll cut with regular mowers, and we're going to use our inmates that we finally got now to be using in places like Magnolia, Wakulla Garden. Some of these areas we've got county roads that have ditches, et cetera, and we're going to maintain those, as well as some of our areas out on 319. I want to talk to DOT about us taking over the 319-98 maintenance of intersection for that road, because they don't maintain it properly, and it makes our county look bad for it to be growing up like that. So we've got some movements here we're going to be doing that'll be strictly geared towards fire and effect.
Let's go back to the Wakulla Magnolia Gardens. Are you anticipating getting into the business of us running a weed whacker down a ditch in front of somebody's house?
No, that's going to be up to the people, but there's plenty of lots out there that do not have houses in front of it that we need to maintain.
What happens then when all the subdivisions call and said, we got a lot here with no house, come mow the grass?
That is and we do that in some places. But I mean, that's just as these build out, that'll become less and less of a problem. We just have to deal with it. So.
I just be careful about getting too deep into it.
No, we won't get too deep. But also at the end of the day, they are our roads, and we have made improvements. So therefore, we have an obligation to keep them up and keep them nice and keep them attractive.
I sent a proposal in years ago about having like 1 or 2 people just for Crawfordville. I know nobody really wants to
That's
hear
coming.
that.
That's probably coming.
We got sidewalks that got to be maintained.
We got to buy an edger and an
All that
edge,
stuff.
and I want an edger going all the time. And those are things that we've got to do that. But we've made I'm telling you, this ditching crew was one of the biggest things we did that'll pay dividends into the future of what we're doing already. St. Mark's is better. They can handle a storm now a lot better than what they could before. The system can flush itself, and as you know, at St. Mark's, it flushes both ways according to the tide. But now it can actually flush, and the same thing with Panacea. We're doing a lot. There's about a foot relief in Panacea. We've made great strides there, so we're making a lot of difference. One of the complaints that we had earlier last week was our guys were leaving trash in the ditch. That won't happen anymore. All right, they're going to pick the trash up. That's unacceptable. So those are things that we're going to be doing, and that's the pride that we have to build in to what we're doing.
We need to look at that intersection too. It blocks some cutoff in Woodville Highway at the bike trail. We
Right.
got that area sectioned off for wildflowers, and that looks terrible. I mean, it's
You're right.
past the point of wildflowers, and it's like weeds.
As my folks can tell you, that looks like Fido's butt.
Right.
And it needs to get fixed, and we will fix that.
Sandspurs and kudzu. no
It's
wild.
terrible.
Yeah,
It is
and,
terrible.
and so you're right, that is one of those Fido areas.
Yep.
Anyway, go ahead, Brandon.
All right, go to the next slide then.
But they need to get out there and maintain it if they want to keep it looking good.
So talking about anything else about the road fund while we're there? Good, okay.
20 minutes, isn't it?
I know,
They got the
you're
little
talking too
signs
much.
out
Fire
there.
fund, so our costs here are budgeted to increase about $160,000. That's FRS. These guys are special risk, so whatever they make a year, we pay almost 25%, or actually we do pay 25% to FRS on their behalf. Health insurance, and then the other big factor with personnel here is these are not your typical 8 to 5 Monday through Friday employees. Their regular hours per year is almost 3,000 versus a regular 8 to 5 employee, which is about 2,000. So even though they may have a comparable hourly rate to a other frontline employee, it's just inherently they work more hours, and some of it is built in overtime as well. So anytime they work over 53 hours in a pay week, then it's actually considered overtime. So the costs for personnel in this fund increase kind of faster than they do other places because of all those factors. It's like the perfect storm in the MSBU fund. So go to the next slide. So we're looking at our current assessment rates for the MSBU here, the $99 per residential dwelling, applying a CPI and going to 102. Really, in the MSBU fund, that's where your revenue comes from. It's almost $1.3 million of the 1.6 we collect. The commercial is about 340,000. So your substantial revenue is coming from your residential dwelling units. I've actually compared, and this is 2017 to 2018 because we don't have 2019 numbers yet. Brad's working on that for me. But we've experienced a pretty similar rate of new construction starts, so I think it's comparable. So your growth from your new construction and your residential gives you about $20,000 a year. The CPI gives you about $49,000 a year. So you add those together, and that's about $70,000 roughly. So you can see how the costs, and also you have not just health insurance, but the MSBU fund has liability, property insurance, and that kind of stuff as well that increases. And so your regular growth is not enough to handle the increases in this fund. We could look at addressing that allocation and moving some of it off of the MSBU fund, how we just talked about the dual certified employees are paid partially out of EMS, partially out of fire. We can move more of that off of the general fund, but then you just need more money in your general fund. So it's kind of like 6 of 1, you know, but your growth is definitely not covering the cost increases yet.
But the good news with this fund is the actions that you guys took, which are good last year, is we did a correction, and then you passed the CPI. That we have seen the fund is correcting itself. In fact, this year, last year 2 years ago, we corrected the fund. And this past year, we actually, the fund actually built on fund balance. And this year, the fund will probably net zero, or we'll put a little money in the bank. That's the reason you're saying you're looking at a $160,000 increase and saying, and you're only going to cover it with a $60,000 worth of extra revenue. But what we don't want to do, it doesn't make sense to make any adjustments right now, because every year we seem to be, since we made the adjustment, it's correcting itself. So we're just saying we want to hold to our CPI and our growth, and just hold that, and not, because we could over revenue it and all of a sudden we'd be giving money back, and that doesn't make sense.
I thought we had that resolved.
That's right, and it's resolved. This fund has fixed itself. It's just
going in the
moving
right
forward.
direction.
Just understand, every year, just like the sheriff's department, it's going to be a nut every year. 160,000, they're 400,000. 160,000, 400, every year. Doesn't matter what you do. That's just
So the
the way it is.
Fire, MSBU is still going to be subsidized by general fund?
No.
Okay.
No, if MSBU is standalone now, it's no longer subsidized. We cut the in fact, now it's going to be paying the general fund back the subsidy that it had. So it's healthy. The fund is healthy
The only
today.
money that gets transferred from the general fund into here is just the hardship exemptions, the general fund's coverage of that. So we're still going to be about $180,000 below fund balance policy, which would be our 25 to 33% of the annual or 3 months of operating expenses, but definitely going in the right direction. 1 cent sales tax. We can blast through this pretty quick, I think. So we're looking at about $2.7 million in revenue, and what we're talking about here is just the revenue we anticipate. Doesn't include any cash balances that'll be brought forward. I usually do that closer to August when we've got a little more of the year behind us. And so this is the planned expenses are going to be on the next slide for each of the individual buckets that we have here, which is our facilities, parks, road, and public safety. You can see that from David's 1 cent sales tax 5-year plan, these are the scheduled equipment purchases or different things that we intend to do with each one of these buckets. We got about $523,000 there scheduled for the facilities. We're collecting $636, so we may have some cash that's left over that'll just roll forward. Look like
The radio system, we're going to try to get out of.
We are, but it will require some matching funds.
skin in the game.
And yeah, it's going to be, we're going to have to put some skin in the game, but also, I don't see it here, but there's also the regular nut here is going to be the payment for the fire station, comes out of here as well. All right, parks.
Oh, it wasn't in your book.
It was in my book. You didn't pull it out. It was too complicated.
So for parks, we got about $429,000 scheduled plan. Now, a lot of these things are going to be timing, too. We may be able to get all this done. We may not be able to get it done. So if we can't, we'll roll it into the next year, or maybe something comes up and we decide we're going to do something different. So this is meant to be very fluid fun. We plan for what we can, but we want to leave a little bit of capacity in there to be able to take care of the things that come up and surprise us, such as when we buy Mark Hudson's property up there on Wind Lake Road. So we have that availability of budget to be flexible with this fund. We always over budget here because we want to spend this money. And so if we over budget and I get into November and realize I just reduced down what cash was available to bring it into actual. So this is just very, very fluid, but this is our plan that we work from. Got $3 million in roads roughly for next year. May or may not be able to get all that done. It just, timing is everything.
Just a high level, real quick on the roads. Our plan for next year is, one is to finish out Wakulla Gardens. Magnolia Gardens paving will be finished this year. This will finish out
the roads, just the ones with
just
sewer.
the ones with sewer, and Wakulla Gardens. We'll finish topping those, and we'll be waiting for the next tranche. But also, it'll be the Lonnie Raker Road realignment, Council Moore, as well as the Wooden Lake Road realignment will be a part of this. Spring Creek Highway and Shadeville intersection, they will be putting the north-south turn lanes in and new lights there to control that traffic better, as well as an MLK putting up another caution light. We've got a number of roads that are going to have to be resurfaced, so we got to wait to see some of this timing, but we'll be bringing that to you as we usually do, probably in December or January next year, based on how the timing of everything washes
Say
itself
Lonnie
out.
Raker realignment, are you talking about where it's dog
Well,
road, or are you talking about paving,
No,
dirt
paving,
park?
I'm saying dirt park, the dirt park. But also, that is, we are working on the Lonnie Raker Road and East Ivan intersection. We're actually working on a roundabout scheme there we're going to bring to you guys.
Talking about where that road jogs, Lonnie.
Well, that's going to be a fix as well, but because we got to fix that. The pressure, there's a lot of pressure in that area. It's going to be a lot more pressure, and that's a very dangerous intersection. We need to slow the traffic down, and we've looked at all kind of traffic calming, and the roundabout seems to be the best for the money. So we're looking at that and we're bringing that to you guys as well.
And we're done with acquisition on the dirt section of Lonnie Record, that's all.
Yeah, we do have one little problem we're working through right now. We just found out about today.
Okay.
Randy Merritt?
Nope.
Nope, and, but we're working through that. It's not a showstopper at all. It's just a bump in the
My
road.
part's already paid.
Okay.
All right, yeah, let's hit sewer fund real quick because it's
Who lives on
important.
that road?
Wastewater treatment is expensive, and we're looking at the additional cost of operating. What?
Screen, you gonna change this?
Oh.
I changed my screen on my computer.
Anyway, so now with our new plant up and going and the cost of chemicals, the cost of the operations being ESG, it's $1.1 million just for them each year, and the utilities have increased. So looking at our 5-year projections, this is not sustainable to continue to do this.
1.1 million.
1.1 million.
The whole public works 1.8.
So this is one of those that we're going to look at, just like we did Road and Bridge, and see how everything works. But we got some a lot of capital projects going on right now. So we've just got to look at it. You know, one of the problems we have is, as you know, we have 90 lift stations, and we have more lift stations than City of Tallahassee does, and majority of cities. So that's a complicating factor, as well as, you know, now we're also treating, people need to understand, we're treating our waste at the highest level that you can treat it. So, and that is not cheap. It's not cheap. It's very expensive.
What's the staffing requirements now?
Staffing requirement 16. So we're having to staff at 16 hours a day, 7 days a week. And, you know, and we've got, like I say, the water we're putting out is and will be.
Yeah, they would drink it.
It could be drinkable, but I mean that comes at a cost. You can't do that with just flipping a switch. It comes with a very high cost.
So our new connections that we're bringing on in Wakulla and Magnolia Gardens, and we're going to keep marching through there and doing that, but it's looking like that's not going to be enough to offset the increased operating costs. And then we're retrofitting the old plant, and then we'll probably need to turn around and talk about Train 3 real quick. So
We're gonna need a rate increase or
it's an
something?
expensive business. I believe the rate increase is included annually.
Well, CPI is included annually, but I don't think a rate increase at this point in time. Like I say, we're okay right now. It's just something in the future. It's not sustainable for the future.
And we can't use access, because we're fixing to.
No, I've purposely separated the access fees, because it needs to be where we can pay for plant and pay for capital needs out of this fund, and then operations pays for itself. You can't, when you blend the two, you distort the picture, and then you don't know what you got.
How about getting the rest of the coast on sewer?
That's going to be a job. Talcon has got to be willing to sell. Until they're ready to sell.
Or give. I wouldn't pay them.
Our first ask was no way we could even come close to justifying what they wanted. Not even close. So, but that's something we'd love to do. And we've already, like I say, we've approached it one time. I'm going to approach them again, probably this year, and run that by, and I'll approach them to eventually wear them down.
Well, it would clean up a lot of our coastal
Yeah.
pollution problems.
Yeah. So any questions before? You got 7 minutes.
No pressure.
I think Randy asked them all.
I was going to say,
They're in the process.
Ralph,
I'm good.
Mike, Chuck?
So,
I use the bathroom.
You can get there for everybody else.
again, we have 7 minutes till the board meeting starts.
All
I
right,
guess we're
adjourned.